Thank you, Madam Chairman. Thank you, Mr. Secretary, for being here. How many cases of coronavirus do we have right now in the United States?
Well, we have 14 cases plus an additional, I believe it's 20 or 30 some odd cases that we have repatriated back into the U.S. from a number of cruise ships.
And how many are you anticipating?
Again, we're working with HHS to determine that.
How many are you anticipating?
We do anticipate the number will grow. I don't have an exact figure for you, though.
Do you have an estimate? Is someone modeling that? Do you have any way of guessing?
Again, HHS, through their medical professionals.
Well, yes, sir, but you're head of Homeland Security.
Yes, sir.
And your job is to keep us safe.
Yes, sir.
Do you know today how many the experts are predicting?
We only know that, again, we anticipate those numbers to grow in the U.S. That's why we're making sure that our operations, again, at our airports, land ports, and elsewhere are flexible.
But you can't tell us how many your models are anticipating.
No, Senator. Again, I would defer you to the Health and Human Services for that.
Okay. Don't you
CDC.
think you ought to check on that
We will.
as the head of Homeland Security?
Absolutely. And again, we have task force members that are working this on every day.
I'm all for committees and task
So
force.
we're coordinating with them to make
But
sure that our
You're
operations.
the secretary. I think you ought to know that answer.
I understand that.
How is the coronavirus transmitted?
Through a variety of ways. Obviously, human to human, we've seen that. And again, we're making sure that those procedures, as they come into the U.S., are medically screened so that we can identify those
How
folks.
is it transmitted?
A variety of different ways, Senator.
Tell me what they are, please.
Again, human to human is what we've
Well,
primarily
obviously, human to
seen.
human. How?
Being in the same vicinity, physical contact is usually what we've seen from the medical cases that we've seen here in the U.S. We've had several, I think 2 to 3 human-to-human cases that have showed up here in the U.S. So it's those that are closest to those individuals that have that human contact.
What's the mortality rate so far? Nationwide,
I believe it's
worldwide.
Worldwide, I believe it's under 2%.
How much under 2%?
I'll give you an exact figure. I'll check with CDC on they're monitoring the worldwide mortality rate, and I can get that for you.
But you don't know the mortality rate today.
It changes daily, Senator.
Well, I understand that.
Given
What's
about
the average since we discovered the virus?
Again, it's under 2%. It was as high as 3. Numbers were recalculated based on reporting
Is
from
it
China.
between 1.5 and 2?
It's between 1.5% and 2%.
Okay, what's the mortality rate for influenza over the last, say, 10 years in America?
It's also right around that percentage as well. I don't have that offhand, but it's
sure
right around
that?
2% as well.
You sure of that?
It's a little bit, yes, sir.
Okay. Do we have enough respirators?
To my knowledge, we do. I'm focused on making sure that our operators at DHS make sure that they have the protective equipment. I know HHS, as part of the supplemental,
We just heard testimony that we don't
testimony from,
in a briefing.
okay,
So you're head of Homeland
for
Security.
medical professionals or for sorry, I
You're
don't
head of
understand the
Homeland
question.
Security. Do we have enough respirators or not?
For patients, I don't understand the question.
For everybody, every American who needs one who gets the disease.
Again, I would refer you to HHS on that.
Mr. Secretary,
My budget
you're
supports.
supposed to keep us safe.
My budget supports the men and women
You're
of the
the
Department of Homeland
Secretary of
Security.
Homeland Security.
Yes, sir.
And you can't tell me if we have enough respirators.
What I would tell you is that the budget, my budget, our operations are focused not only on the men and women of DHS, making sure they're protected to do their jobs, to screen individuals coming in. We're working with HHS,
You don't know.
CDC, and their
You don't know
budgets
the answer, do
to
you?
ensure that they have enough medical
Do
equipment.
we have enough face masks?
We, for the Department of Homeland Security, we
I'm
do.
not asking for the Department of Homeland
Are
Security.
you
I'm
looking
asking for the American people.
for the entire American public?
Yes.
No, I would say probably not.
Okay. How short are we?
I don't have that number offhand, Senator. I'll get that for you.
Okay. But I want to be sure I understand. Somebody
Yes, sir.
is doing modeling
Yes, sir.
on how many cases we're anticipating. You're
Yes,
just
sir.
not aware of them.
You're asking me a number of medical questions that
I'm asking you
CDC
questions
and
because you're
HHS
Secretary
are
of the
focusing
Department
on.
of Homeland Security, and you're supposed to keep us safe.
Yes, sir.
And you need to know the answers to these questions.
And
How far away are we from getting a vaccine?
in several months.
Well, that's not what we just heard testimony about.
Okay.
Who's on first here?
HHS is
What's
the
on second?
federal agency for the coronavirus response.
You're telling me we're months away from having a vaccine. That's your testimony as Secretary of Homeland Security.
What I have been told by HHS and CDC, yes.
And have you probed that to make sure that's accurate?
Yes. We continue, every day we have task force meetings with those individuals and elsewhere talking about a number of these.
Well, your
issues.
numbers aren't the same as CDC's.
Then I would certainly defer to CDC on our medical questions.
Well, don't you think you ought to contact them and find out whether you're right or they're right?
We're in contact with them every day on our task force.
But you don't know why you have a discrepancy.
I would refer you to the CDC on specific
Mr.
questions.
Secretary, I'm going to hush here. You're supposed to keep us safe, and the American people deserve some straight answers on the coronavirus. And
Senator,
I'm not getting them from you.
I disagree.
That's all I have, man.
How is severity determined?
Severity is determined usually by fatality rate against the number of people infected.
Right, obviously. Let me rephrase that. That wasn't a very artful question. Some people get really sick, others don't.
Right.
Why the difference?
Well, we don't know. That will depend on the nature of this disease. For instance, with the 1918 flu, the so-called Spanish flu, it was interestingly your healthier, young, middle-aged adult males that seemed to have the worst reaction and greatest severity.
Let me stop you, Doctor. Yeah. I don't want to get too far afield here. The short answer is we don't know, right?
We don't know right now, no.
Okay. How many face masks do we have?
We currently have 30 million N95 respirators in the Strategic National Stockpile.
How many do we need?
Dr. Kadlik mentioned to the Senate this morning needing approximately 300 million for healthcare workers.
We have 300 million healthcare workers in America, do we?
No, that would be assuming the need to swap out used ones.
Okay. What do your models show about how many cases we're anticipating?
Well, we don't know because we don't know the full attack rate in China. So, for instance, we've seen a high of 30% infection on the Diamond Princess, approximately, which was frankly, it seemed to be an incubator. In Wuhan, China, it's very hard to know what the total accurate number of cases are.
We don't know then.
We don't know.
Okay. Do you have models to try to answer this question?
Well, we can only extrapolate based on the data we get from China.
Is China telling you the truth?
We are getting data from China as the world is, but whether that information is full and transparent, we just don't know.
What's the mortality rate of the coronavirus?
It's showing right now anywhere between 1% and 2%, but again, that's based on a denominator. There may be many, many more cases in China that are low symptomatic or haven't secured treatment and hence aren't in the Chinese reported
What's
cases.
the mortality rate of influenza?
Seasonal influenza tends to be 0.1% mortality.
Okay, so we're talking about a substantially higher mortality rate.
It could be, again, dependent on what that denominator is. That's why we need to use great caution in making predictions about the severity of this.
How soon will we have a vaccine?
Well, as I mentioned, Dr. Fauci and the Wall Street Journal today talked about this going into clinical trial amazingly within 3 months after discovery. We could within a year have a vaccine, but we want to, through the supplemental, put multiple vaccine candidates out there. We have $1 billion of proposed investment in vaccine through the supplemental.
The Secretary of the Department of Homeland Security, which is charged with keeping us safe, just testified about 10 minutes ago, a month and a half. Which is it?
One could not develop a vaccine in a month and a half. That's never happened in human history.
Maybe you ought to talk to the Secretary of Homeland Security.
But I would like to defer if I could. We'll be happy to get you from scientists the best assessment of transmissibility of the disease.
Can it be transmitted through food?
We do not believe that there would be fomite transmission through food, but we still are trying to learn of the sustainability of the virus on surfaces. That's what we call fomite transmission is. And Dr. Fauci has said he does not believe that there's a reason to believe it should survive more than a couple of hours on hard surfaces.
So it can survive a couple of hours outside the body.
That is what Dr. Fauci has said is the working assumption, but of course we do not have firm trial data on that yet. That's one of the things we're hoping to learn from the WHO team in China.
Can do. Every country needs to be ready to detect cases early, to isolate patients, trace contacts, provide quality clinical care, prevent hospital outbreaks, and prevent community transmission.